So in September 2018, the Mayor of London created or announced the creation of the Violence Reduction Unit. And this was set up to bring together expertise from a range of different sectors, including health, local government, police, and community organisations, to address violent crime and the underlying root causes of violent crime. And I'm delighted to be joined today by the director of the VRU, Lib Peck, and Lauren Ricketts, who's Principal Research Officer at the VRU. So perhaps we could start by giving a little bit more background on what the VRU actually is, how it came about, and what its goals and aims are.
Great. Well, thanks very much, Kieran. Really pleased to be here today. You mentioned in your introduction that the Mayor of London, Sadiq announced the establishment of the VRU in September 2018. And that was principally because I think we in London were looking at figures that were completely unacceptable in terms of levels of violence. And we'd seen that increase from about 2013-14 up until the period he announced that. And there was a sense of we need to try something different and we need to look elsewhere for good examples. And there's a very good example relatively near, which was up in Scotland, which had been championing for about 10 years the use of a public health approach. And I'm sure we'll come back to that term, but very much looking at a preventative early intervention approach, one that's rooted in public sector partnership, and one that is absolutely led and determined by young people and communities, and that relies on data to both inform but also data to evaluate what is working. So that was the announcement. We didn't really get up and running until March 2019 when we started to assemble a team. And we've obviously spent some time assembling a team, as you mentioned, of very different people from different professional backgrounds, but making sure that that kind of reflects that sort of partnership approach. And the aims of the unit are, as you would expect, to reduce violence, but also in a more sophisticated way to increase feelings of safety and to make sure that young people and communities are very much at the heart of developing solutions.
Great. So you mentioned already public health approach, and you mentioned the examples that you're drawing from. How much of a link did you have at the setup stage and now, I guess, with the already existing VRU in Scotland? And what kind of advice, what lessons were you hoping to take from there? And I guess keeping in mind, as a lot of scholars often do, that context is really important. And so you obviously can't just take this from somewhere else and apply it to London. It's a very different case. Yeah. What was it that was useful for you?
So the guys from the Scottish VRU were very involved from September. There was a partnership steering group, that was before I was appointed as director and before we actually really had a unit in place, and they did inform the thinking. And the few of us in the unit that were employed by the May the following year, one of our early visits was up to Glasgow and to spend a fascinating couple of days. And what we took from that, I suppose, and mindful of your point about context, what we took from that was inspiration, i.e. a determination and a partnership approach works and you've got to stick at it. And they were 10 years in it. And, that's a really important lesson. Secondly, obviously, some of their learning about, how they'd done that work with other organisations, but how they'd seen what the kind of key ingredients were for a successful approach. And then thirdly, a few specifics, and we may come on to this as well, but one of the highlights of the trip for me was going to speak to Maureen McKenna, who's Director of Education at Glasgow, and she spoke so authoritatively and passionately about the causation between and the correlation between more importantly, the correlation between violence stats and exclusion stats. And that really got me in the space when we came back of thinking, right, this is an area we absolutely need to be focusing on. And interestingly, focused on from a perspective that was different from when I first went up to Glasgow, where I'd have thought we'd have been campaigning against exclusions. And in fact, what she was demonstrating incredibly well and powerfully through statistics was, in fact, she'd done that through encouraging inclusion rather than campaigning against exclusion. So I suppose there was a kind of lots of different lessons, but you're absolutely right. London's 32 boroughs, hugely diverse, engaged communities, very different structures for lots of public sector, organisations. The NHS itself is hugely complex. Local authorities aren't education authorities, and then of course you've got borough commanders that don't necessarily fit into the same shape as local authorities. So a complexity of structure, a complexity of communities, I think, and a very different history and context for violence, which means you've got to be true to the public health approach, which is finding solutions for the context you're in. And that's where we focused a lot on people, place, and the context and settings, and that's been the approach we've taken.
And I mean, this public health approach, I was looking at these kinds of incidents prior to the creation of VRU, but also prior to the increase, or at least the reported increase in violence in London. And as that especially in the media, the discourse around knife crime and, a lot of, I don't want to say hysteria, but there was certainly a lot of panic in the reporting. A lot of people were saying, well, where do we look for solutions? And so much attention was going to the public health model. And I think it was because of the success in Glasgow in large part. What has been the response when you've tried to kind of promote that approach, not just within the VRU, but dealing with partners in police and dealing with partners in government? Because there's obviously part of that approach about reframing this from a purely criminal justice approach. Has there been resistance, or been people being willing to kind of embrace this change?
That's an interesting question, really. I don't think we've encountered. Well, the first thing I'd say is that, you use language in a way that's meaningful for people, don't you? So I think that, a public health approach appeals and is understandable to certain, people who are, perhaps in that academic field, or perhaps, have got a health background. To others, it doesn't really necessarily mean anything. And I think then you find the language around prevention and early intervention and working with people, that, you've failed if you've got into the enforcement arena. What you want to be trying to do is give young people sort of optimism, support, hope, ambition, and that's what you're trying to realise. So I'd say that it's quite important that you frame it in the language that's intelligible and that is inspirational and brings people along with you. And in trying to do that, I don't think we haven't encountered any resistance to that approach, but there's obviously always organisational culture that doesn't necessarily embrace that collaboration very easily, and to a certain extent across, some of the VCS organisations, there's an environment that's been created which is competitive for funding, which means that organisations sometimes are competing against one another rather than collaborating, and that's just the dynamic of the situation. So in the principle form, however you describe it, a lot of ambition for that. In the turning that into the practicalities of how you go about it, there's obviously a lot more challenge. I don't know if Lauren wants to add anything to the public health approach perspective, but yeah.
Well, what I'd like to ask you, Lauren, actually, I mean, since you are Principal Research Officer, I know one of the key elements of a public health approach is evidence-based programming. So I was just wondering, what is the research that you're drawing on from this approach? And has it been that there's plenty of existing evidence for you to draw on in formulating how you approach things in London, or are there areas where there are gaps in knowledge? What's the research situation like?
Yeah, absolutely. So back in January 2020 now, the VRU published kind of the first ever capital-wide strategic assessment of violence, and it kind of consisted mainly of two reports. The first one was entitled kind of Violence in London, What We Know and How to Respond, and that really highlighted firstly the ultimate cost of violence in the capital, but secondly some of the evidence behind why we were seeing an increase in recent years, and that kind of goes back to what you were saying before around the context. And we kind of realized that looking at the evidence that a large proportion of the violence increase was driven by kind of proportionately a very small number of highly localized areas that tended to also have high levels of deprivation. And I suppose that led firstly to looking at the research our research focuses now, but also really highlighted when we're talking about, I suppose, those 3 key areas that Lib mentioned. So people, which is propensities towards violence and kind of risk factors associated with violence. Place, so how do environments impact violence? How that could be kind of the physical elements. So looking at areas such as transport hubs, or could be talking about different neighbourhoods' relationships with violence and how that differs, or it could be kind of settings such as schools or prisons, and then the context. So looking at things like the pathways to violence through kind of people's motivations, people's perception of their kind of perceived alternatives, and what that showed, when we did that kind of capital-wide assessment of what we knew, what it really highlighted was that the existing evidence base in relation to violence reduction primarily focused around kind of that first area, so the first lens, people. So it was looking at kind of individuals' risk factors to violence. For example, as mentioned before, and kind of what a lot of the work that Glasgow and other areas are kind of already highlighted really well around kind of the connections between poor parental supervision, weak attainment in schools, and the connections to violence. But firstly, having said this, a lot of the evidence base, even in this area where there is a lot of evidence, is kind of either outdated or not London specific. So that context was kind of not particularly like already usable for us. But secondly, that really highlighted that we had a huge gap in the evidence base around kind of understanding the place and the context, so the situational drivers of violence, and it was very clear that was where our gaps were greatest, and that led kind of, we're doing 2 kind of major research projects at the moment. The first is looking at kind of an analysis of neighbourhoods disproportionately affected by violence and exploring neighbourhood vulnerability to violence and protective factors against violence. And then kind of a homicides research piece looking at kind of motives and micro pathways leading to violence, and highlighting specific points of intervention that might be useful for us in the future.
Brilliant. I mean, so it sounds like you're already very active then in addressing those gaps and filling them. And if you're already engaged in the research, I guess it's a good time for me to ask the question. We talked about the status of things when the VRU was set up. And for those that aren't familiar with the London case, I would say it was a peak as far as public concern goes about addressing violence, and a real sense that there was a crisis, and it was called that regularly in the papers. Where are we now? What's the situation now? And in particular, I'm wondering how, from your perspective, COVID has affected things. Has this had an impact not just on levels of violence directly, but perhaps in those broader issues around exclusion, around marginalization? Are there going to be consequences? Are certain communities being disproportionately affected? How might this change the environment in which we're working?
Yeah, I mean, that's a huge question, actually, because, yeah, I mean, COVID and the experience of COVID has really, I think, made a lot of people enormously more vulnerable. And that's the sort of, was almost like stating the obvious, but I think it's really important when we were, in a way, addressing things through looking at people's vulnerability, when we were doing it through that sort of people lens that Lauren refers to. And we know that, and some of the work that we've been doing with young people, we know that, you know, the curtailment of social activities and physical activities, the interruption to education, you know, the employment prospects, which are much bleaker, and all of that mounting up and having an impact on sort of mental health. And at the same time as that, we've also seen, you know, organisations having to deal with increased need at the same time as develop their own, you know, deal with their own challenges, either of the model of operation that they've got, or indeed dealing with sort of staff welfare, because, you know, the same people are, you know, who are in these organisations are also the same people being affected by COVID, you know, and so in some respects, I think there's been a huge range of, you know, how to deal with isolation, how to deal with you know, death and bereavement, and how to deal with, you know, digitalization and, you know, exaggeration of poverty, you know, so a lot of contending factors. And for us in the unit, all of that has had an impact in the way that we are working and having conversations with, and sort of funding, I suppose, different organisations and working with community groups and with young people. I wouldn't want to, I've implied that's entirely terrible. And, you know, I do know that lots of organisations who have maintained contact, particularly with young people over this period, have talked about how they've managed to do that in a very successful way. And there are lots of organisations that have digitalised in a really important way of something that they've wanted to do. So I don't want to kind of give that, but overwhelmingly there is a bigger set of challenges there for us and how we've carried out our work, and because of the work that we're doing with communities and young people, I suppose. In terms of what that's done to the landscape in terms of violence, you know, it's quite difficult to detach those, but it does mean it's kind of probably not an entirely fair point of comparison with sort of, you know, the previous couple of years, I could say that. You know, we are seeing some positive trends emerging, some of which were emerging last year, which we want to hold on to. You know, violence for under 25s, you know, has come down. You know, we know that you know, homicide rates are slightly down as well on this time of the last couple of years. So we've got some positive sort of trends, but I'm cautious both because of the kind of COVID dynamic, but I'm also cautious because we are, as we started to talk about, in the long-term game. You know, once we start getting into analysing the impact of the VRU on the number of homicides there have been in any one year, then we are immediately into a short-term solution sort of perspective, and that's really not what we were set up to try and do. So yeah, there's a lot there. I'm not sure that answered all of your questions, Kieran, but that was my attempt at it anyway.
Absolutely. I mean, from a, oh yeah, sorry, no, from a research perspective, particularly as well, I mean, you can imagine what COVID has thrown up, both in terms of I mean, all of the different areas that we could be interested in researching and pursuing, and how we kind of look at what, like Lib was saying, what that does to the kind of long-term life after this knock-on effect of what we learn. But also on when we're thinking about learning from our evaluations and learning of the evaluation of from our interventions, and whether they're what kind of we can learn and how they're doing well, and whether we're having an impact that we intended to have, and how COVID and all of the things that's come with it has disrupted that and disrupted the data and the things. So we don't, the picture is much murkier. But from that as well, I mean, as Lib kind of said, I mean, it's thrown up a lot of really interesting areas and really highlighted some key gaps for us as well. So a really, I suppose, good example of something that happened was from looking at the data, it was very clear that there was a huge spike in child or adolescent to parent violence in London with the first lockdown and with COVID. And at the same time as the data was coming in, we were also getting a kind of intelligence from communities. So through our parenting network and through like local authorities and community safety groups, that again, they were having a lot of, they were seeing a sharp increase in this type of violence. And that kind of led us down much more of an exploratory route. And we kind of realized from that actually there was very little research in this space, especially in context of London. So we're now kind of commissioning a comprehensive assessment of child, adolescent to parent violence in London, which will be really useful for us in helping to shape kind of our parenting, how we kind of approach parenting and families and what that means. And so there's lots of kind of, I suppose, opportunities within all of the negatives that have come with COVID.
Yeah, it's a learning experience, isn't it? And I think it highlights those kind of 2 points. I mean, Lib, you point out about the short-termism not being a good way to judge anything. And then there's the visibility of violence. Simply because you don't see, you know, a more public form of violence doesn't mean that things aren't happening domestically or at home. And I know that's been a concern around the world about what happens during lockdown behind doors that we're not seeing, and finding that out is difficult. I mean, looking towards the future and hopefully a post-COVID world, sometimes feels quite far away. since this is a long-term project, and you know, it's great to hear that there's an appreciation that if you're going to try and address, you know, you're going to try and do prevention and address long-term root causes, you need a really long sweep. This can't be done overnight. What are the kind of the long-term interests or areas where you're hoping to work in, and where might academics, scholars of our networks contribute, or where, you know, what kind of things are you looking from researchers? And then connected to that, obviously context is really important, but will you be looking again like to kind of see what's being done in other parts of the world, both within the UK and Europe and beyond? Is there as a kind of an effort to bring different VRUs and similar organizations together to really kind of have an exchange of knowledge?
Yeah, great, thanks. I mean, to perhaps address that last bit first, yeah, definitely. I mean, you will know that, well, as you said, the VRU London was sort of announced in, you know, the autumn of 2018, and it was, I think, probably in about May of the following year, 2019, that the government then set up 17 other VRUs across the country, which, you know, is great, I think. And as a network now of 18, you know, we do communicate and look at common kind of agendas and learn from one another. And in particular, we have regular meetings with, you know, the slightly bigger urban ones, which we have, you know, obviously a lot in common with. So I think I can only see that relationship sort of developing and deepening. And you're right to prompt the international analysis as well, because I talked just only about the inspiration from Scotland, but there were, of course, other examples internationally, wider, you know, further afield, which also informed that kind of public health approach. And we'd sort of seen some examples in the States and in Canada, and, you know, about, you know, where things had really worked quite effectively there. So we'll definitely keep doing that. And we had an international conference, which now seems about a century ago, but actually was at the beginning of this year, which was one of those examples of sharing just that good practice. And we've been in touch with Chicago about some of the models they've done in terms of violence interrupters, and, you know, very much hope that both the research and our practice and the conversations we're having just continues to expand and deepen, you know, internationally and nationally. In terms of the kind of the kind of emphasis, I suppose, of our programs, I mean, and then I'll pass on to Lauren to talk about some of the kind of research and academic connection to that. I mean, we are still in a fairly relatively new formative phase. So we are interested in, you know, exploring things where we think there are gaps, where our analysis, you know, points out, be that analysis from conversations or from statistics, you know, points us in the direction of, and where we feel that we can usefully spend some resource to demonstrate an innovative way of change. So that won't change, but that you know, that will only again hopefully increase. But I think some of our key projects really are around definitely strengthening our place-based approach. We do violence reduction plans. We're working alongside some of the key public sector organisations, but within each of the local boroughs. And that is a really good mechanism, I think, to talk about issues of place and bring together public sector partners. We've got a similar kind of project that we've just launched, but we're very optimistic about, which is called My Ends, which is a very neighbourhood approach, which is trying to strengthen those community networks and to sort of fund both those to provide that sort of longer term resilience, but also the interventions they're funding. Those are two key strands of our work. And then some of the programs that we're developing, either around youth practitioners, where we've got a good training program and we're trying to bring together lots of the different types of youth work, or the parenting approach, where we know that you know, there's a lot of good initiatives going on, usually outside of an institution, and how do we strengthen those networks? Or indeed, you know, the schools program that I referred to earlier. So, you know, I think we'll continue to be guided by the research and the evidence, but I think, you know, those as kind of key programs really that are addressing obvious need at the moment will probably continue as our strategy.
Yeah, absolutely. And I suppose from a research perspective, one of the things that we recognise as like incredibly important and something that we're really trying to kind of focus on what that means long term, is that linking research to innovative or new practice and new ideas. And like Lib said, we're very keen to do things differently, and that's exactly the same with our approach to research. And that, so we recognize that we want to be evidence led. We recognize and value that there are different forms of evidence. And so, for example, we recognize and kind of value the pursuit of absolute truth and highly reliable and often scalable research that comes from kind of scholars, and then the intelligence that comes from the community, whether that be from kind of discussions, so such as our parenting network that I kind of mentioned earlier, or through reports that are co-produced or kind of with or by communities. And that evidence is often less valued, but there is a lot of value in it, in terms of they produce kind of highly contextualized and often from the widest parts of community, and often community research or research community coming from the community kind of explores areas that are difficult to research, like traditionally or academically. So it's about, for us, it's about how do we marry up the quality of that scholarly research and that academic expertise that we know exists to that nuance and that authentic community experience, in order to provide us with the best tools for London. And it's about that research leading to pilots, and then how do we evaluate interventions that might not be being kind of conducted in a traditional way, or it's being conducted in a new way, and then how do we evaluate them effectively to know that they're contributing to our wider evidence base on what we scale and how we kind of support violence in London. So
I mean, excellent. That's great to hear as someone who works in this space. I think there's been a tendency, understandably, to go towards the RCT only kind of, evidence base, and there is so much knowledge within communities. Not all of it is necessarily useful in other contexts, but there's so much local expertise and experience that I think from the researchers' academic side, they need to engage more with, often in cases. And there's a lot of value in those kind of qualitative approaches to complement more kind of systematic studies. But I know, obviously, if you're trying to make policy and you're trying to show evidence, you also need numbers, you need something robust and systemic. So it's got to be a bit of everything. But I think from the sound of it, kind of the more of this and the deeper we go in kind of all directions, is going to be useful. Thanks both so much for taking time out of your busy schedules to chat today. It's been really informative. And we'll keep an eye on your work, and best of luck with everything. I hope it goes very well.
Great. Thanks very much, Kieran.
Thanks very much, Kieran.